Hey everybody, Dan here with Pain For You. Today's topic is going to be, do this, but only if you want to get better. So I'll explain that in a minute. We're going to take a couple of nice deep breaths. Don't know if you can see it back over there. Let me see if I can zoom in. There's a couple of deer in the corner. They're standing pretty still. Yeah, one's walking above that. Anyway. So, take a couple of breaths. I love seeing the deer out here. Breathe in the nature. Alright. And here comes a motorcyclist, thinking he's all sorts of cool. Alright, we'll let him pass. So, the topic of this video is, do this, but only if you want to get better. So I'm going to encourage, the do this is to stop looking for all the reasons that you're broken and that this won't work. You know, I talk to many people. You know, I get half a dozen emails a day, Facebook messages, and inevitably people are really stuck trying to buy into the idea of TMS is causing my pain. And they've got all these seemingly logical reasons why their situation is different, and that it's not TMS. And they will look for and grasp onto almost any reason that says TMS is not the issue. I'm really broken because this happened, or that happened, or it feels this way, or it feels that way. And no matter how many times I tell some of these folks, no, it still fits into the TMS category. And if you've done the assessments and your pain is behaving like TMS, it doesn't matter how severe the pain is. It doesn't matter how constant the pain is. It doesn't matter that you had a minor fall. The minor fall may have been just enough to convince the brain that, holy crap, you damaged yourself. And the more times you convince yourself, yep, I got a real problem, got a real problem, got a real problem, the brain's going to believe it and keep the pain persistent. And then you'll say, well, the TMS approach isn't working. No, it's because you haven't truly said, this is TMS. You keep on jumping back and forth to the structural reason. You're scaring the crap out of yourself. And so, it's really easy to want to have a doctor fix us. You know, well, a doctor promised me that, they could fix this nerve, the pudendal nerve, for example, and there's some really expensive, very invasive surgeries for this type of stuff. But I don't know if that's going to succeed, especially if it's a TMS-caused pain, right? TMS means the brain is creating the pain. So how is operating down there going to solve a brain-created pain syndrome? Unless the surgery is the ultimate placebo, and that they're convinced they're better, so they get better. And that very well may be the case. But if the brain and the nervous system is still hyper jacked up and overprotective, overstimulated, it's possible that either that pain will come back or it'll move somewhere else. So before you opt in for any type of surgery or invasive medical treatment, you really got to get clear. Is it a true functional issue? If they're claiming nerve damage, is that diagnosed based on the presence of pain, or nerve conduction tests, or true imaging studies where they can prove that the nerve is damaged and that is why it's firing off? But make sure to ask really pointed questions. Hey doc, if in fact that is the case and this nerve is damaged, how is it possible that this hurts or that hurts too, right? Just interacted with somebody who said, oh yeah, I injured my hand and that created a pain in my neck and also my hip. And ask the doctors, anatomically, are they connected? And how is it possible that a hand or wrist injury is creating problems in the neck, upstream, and also in the hip, completely different part of the body? And what I perceive is happening is that the brain is just more and more terrified and in a panic and becomes more overprotective, more hyperstimulated, and that can create pain kind of moving and growing into other areas of the body. So when I say do this, but only if you want to get better, do this. What I mean by this is accept that TMS is what makes sense. And if you're not sure, spend the time doing the analysis. ppdassociation.org/symptoms. ppdassociation.org/symptoms. Answer the 30 questions. You'll get a real good idea as to whether or not your symptoms are behaving like TMS. The more that you say yes to, the more likely it is. Or a true structural problem, because a bum hip doesn't take a vacation when you go on vacation. It doesn't feel better when you are, enjoying yourself. A bum hip is going to hurt all the time, right? And nerve damage doesn't just take a vacation when you're laughing, having some fun with, some friends or neighbors, and then come back 4 hours later. So there are definitely tells and indicators that your symptoms are behaving like TMS. If you want to take the pain test, yourpaintest.com. It's a 10-question quiz. It'll give you a score. Anything over 29 means your pain is behaving like TMS, not a structural problem. So I will encourage you to stop looking for all the reasons that you're broken. I will encourage you to stop telling yourself the story that says, I am broken, I'm screwed, this is my life forever, I'm never going to get better. Because inevitably, if you do that, you're going to be disappointed that this half-hearted TMS stuff isn't working for you. So if you're half-heartedly committed to the belief that says TMS is my cause, and then you are disappointed that it's not working, the reason it's not working is because you're confusing the heck out of the brain. You're telling it 1 minute, yeah, it's TMS, I'm okay, but then the next minute you're going, but oh my God, what if it's this? What if it's that? What if this is permanent? What if my body's all jacked up and broken? Right? You're scaring the crap out of yourself and then wondering why the brain is not coming down from this hypervigilance and oversensitivity in the nervous system. So only do this, or do this, but only if you want to get better. So do this means make a darn decision that it's TMS and nothing else makes sense. Decide it's TMS. Commit to that decision, but only if you want to get better. Because if you don't commit to that decision and commit to the diagnosis of TMS, it's going to delay recovery. I don't want that for you, right? I don't want that for you, and it's not necessary. So if you're on the fence, you're debating between TMS or a real structural problem, do the analysis, revisit that, learn a little bit more about TMS if you're unsure about it. Watch the video at painfreeyou.com. There at the homepage. Get really, really certain. Clarity really, really matters. And then make a decision and stick with it. Because every time you go back to it might be physical, what if this, and the doctor said this, the chiropractor told me that, the physical therapist told me this. I guess my question is, if they were so smart, they would have fixed you already. And if they haven't, then perhaps you don't want to take their advice or accept their prognosis or prediction for your future physically, right? I love doctors. They are the most well-meaning, greatest people. I have a number of friends who are doctors. But as it relates to determining the cause of most chronic pain, they are ill-equipped. They're not taught that stuff in medical school. So they always go to what they were taught, which is structure is the problem. So if they can find any abnormality, they're going to point to it and say that's it. But we know that how the pain behaves is a much stronger indicator of TMS than any abnormality shown on the imaging study. And do not forget, Dr. Sarno, TMS 101, first day of class. These are normal abnormalities. There are many people with meniscus tears, rotator cuff tears, who have no pain at all. So if you happen to have pain and they find something like that, that's still not evidence that the tear is causing the pain. See how the pain behaves. That's the real indicator. Because if it takes breaks, goes up, goes down, is on a schedule, doesn't hurt until noon, but it's fine in the morning, and etc., etc., it's TMS. And so teaching your brain that your body's okay is foundational. That's really what it's going to get to cause your brain to make a different decision to stop utilizing those pain pathways and turn them off, right? So you understand, if the purpose of pain is to protect you from a perceived danger, you've got to cross this rotator cuff tear off the list of dangers. Because if so many people can have them and never have any pain, it's not dangerous. And I'm not suggesting you start going and doing some crazy, lifting or exercise or, powerlifting programs. But I'm saying normal living is fine. Normal exercise is fine. Again, if the tear is catastrophic, the doctor would say that when they see the tear. But if they're saying, oh, you've got a tear there, be careful, does it warrant surgery? Well, we could do surgery, or it does warrant surgery. But doctor, how many people have the same degree of a tear and no pain and lead a normal life? He'd probably say, well, probably a lot, right? I had somebody recently say, it was recommended to get a hip replacement in my left hip due to degeneration of the bone and osteoarthritis, because that's where the pain was. But if you look at the x-ray, the other hip was actually in worse condition, but there was no pain there. So fortunately, this person saw through that and said, that doesn't make sense. I'm not going to get hip surgery when the other one's in worse shape and doesn't hurt. So they're misplacing the reason for the pain on the arthritis. And so this is a difficult topic, because there are so many scenarios, so many individual experiences, medical diagnoses, imaging studies. The most important thing to do is evaluate how the symptoms and the pains are behaving to determine whether or not the pain is coming from this perceived abnormality or tear or injury, if you will. And so many people say, oh, I injured my shoulder, or I injured my my back. And then when they looked, I found out I had a herniated disc. So my first question is, how did you injure it? Were you in an accident? Did was there a fall? Oh no, it just started hurting when I bent over. So how did that injure you? Oh, well, I don't know. There was a herniated disc, so that must have been when it happened. And so the body is not that frail and easily broken. We don't pop discs just by bending over to pick up a laundry basket, So try not to equate our pain to a physical cause unless you have evidence that it is. The doctors will point to it and say, there's your evidence. But ask them, do other people have this similar thing, this similar diagnosis, and no pain? Because the answer is yes. If I don't post it, remind me, and I will share a chart from a study that Dr. Schubner shared with some of his trainees. And it shows what percentage of people with no pain at all have certain abnormalities. Now, it's mostly focused on the back, but it's a real good indicator that so many people, as we get older and older and older, have certain medical diagnoses or imaging studies results, and yet no pain. So it's just more supportive evidence. So remind me on Facebook. I'll post it in the first comment. And on YouTube, maybe I'll put it as a post and share the actual image. So remind me in the comments if you don't see that, and I will make sure to put that up there. So make a decision that it's TMS and nothing else. In other words, do this, but only if you want to get better. Because if you fail to make that decision and fail to, accept that TMS is the reason, the only reason for your pain, it's going to take a long time to get better. And it may delay it indefinitely until you make that decision. So you may as well do your homework up front, learn about it, do the assessments, make that decision, and stick with it. Commit to it. And every time you start questioning, you go, nah, we're not going back to that wishy-washy, I don't know what it is thing. Look for evidence that it is TMS. You'll find it. So, been blabbering on for 15 minutes here. Hope this helps. Hope this makes sense. Make a decision and a commitment, but only if you want to get better. So, love you guys and gals. I'll see you tomorrow.